Chapter 2, The Dawn of Development, Prenatal Development. So in this section, we're going to talk about the stages of prenatal development, the critical factors in prenatal development, the complications in pregnancy, prenatal care, and reactions to pregnancy. So the stage of prenatal development. The average length of a pregnancy is 280 days, and it's a period of remarkable growth and incredible vulnerability. And it comprises of three stages: the germinal stage, the embryonic stage, and the fetal. So, stages and trimesters. Well, most people think about pregnancy in terms of trimesters: the first, the second, and the third. However, developmentalists focus upon three periods of prenatal development that are focused on biological markers. So, the germinal stage, which is 0 to 2 weeks, the embryonic period, which is 3 to 8 weeks, and the fetal period, which is 9 to birth. Now, these periods do not correspond with trimesters. However, each pregnancy stage is very important to the development of a baby in regards to its growth and development and being able to survive outside of the womb. Trimesters, on the other hand, deal more with the physical and emotional periods that the mother is feeling. So trimesters are more about the mother, whereas pregnancy stages are more about the development of the baby. So conception. Well, conception occurs when an egg is fertilized by a sperm cell, and fertilization is the penetration of the egg by a sperm cell. Now, at the moment of conception, the new human being has a unique genetic composition with 23 chromosomes coming from the father and the sperm, and 23 coming from the mother and the egg. The germinal period. Well, this lasts from conception until implantation, which is in the uterus, and around day 10 to 14. Now, the individual is referred to as a zygote during this period. And through hormones, the zygote signals the mother not to reject him or her as a foreign tissue, which means the mother would not go through her menstruation cycle, but instead, the zygote would implant into the mother's uterus. So implantation occurs when the zygote burrows into the uterus. The embryonic period. Well, this lasts from implantation until organogenesis, which is from week 2 until week 8 after conception. At this time, the individual is referred to as an embryo. Now, characteristics of this period is rapid cell growth and differentiation, the formation of the placenta, and the organ formation. And as you can see from the pictures, going from week 3 all the way to week 8, there's a lot of development happening at this time. So you can see the spine starting to develop, more of the head, everything's starting to get very much fine-tuned and starting to look more baby-like. Now, by the end of this period, all the organs are present and functioning to some degree. This is what is known as organogenesis. Now, the fetal period, this begins at week 9 after conception and lasts until birth. And now the individual is referred to as a fetus. Growth and refinement is characterized by this period. So there's quickening that happens, which is the fetal movements, the baby moving. We also have lanugo, is the fine down-like hair that covers the baby. And then the vernix secretion, which is a thick, cold cream substance that protects the baby's skin and is used as a lubrication during birth. Now, the age of being able to live outside of the womb is reached at about 22 to 24 weeks. And this is where the baby really can be able to function, breathe on his or her own with little or no assistance, but depending on how early, the baby still may need some of those development. Because 38 weeks, that's still very early to be able to reach that age of being able to survive outside of the womb without a lot of intervention. So now what we're going to do is we're going to pause and we're going to process what we just talked about in regard to the development of prenatal development. So go back and refer back to the slides as needed to answer these 7 questions. So critical factors in prenatal development. So some general factors are things like the mother's age, the nutrition, weight gain during pregnancy, and teratogens. So let's start with maternal age. Well, high-risk pregnancy is common among younger women. So if you're younger than 18 and then if you're older than 35. So that 19 to 34 is kind of that span where there's not as many risks for pregnancy. Now, older women have a higher risk of miscarriages and tend to bear children with more genetic diseases. Older women also may struggle with fertility. Complications could endanger, of course, both the mother and the baby, or one or the other. Nutrition. Well, what you eat and how much you eat does matter. Now, there is that myth of eating for two. A lot of times when women get pregnant, people will always try to push food at them and say, well, you're eating for two. Well, really? That is not the case. Actually, you really don't need more calorie intakes more than a glass of milk when you're pregnant, especially at the beginning. However, cravings and all those things do come into play. Now, nutrition strongly affects the well-being and, of course, the course for future pregnancies. The quality of the food also matters. Making sure that you have enough folic acid intake is critical, and it also helps to babies not have spina bifida, which is a birth defect in the tissue surrounding the spinal cord where it doesn't properly close during prenatal development, and intervention is needed to help that gap close. Calcium and iron are also very important as well. And a lot of women don't necessarily get enough calcium, iron, or folic acid. So taking prenatal vitamins is very, very important as well. And a lot of times at the beginning of a pregnancy, a doctor will recommend what to take, or if the mother has low iron or calcium or folic acid in their blood when they have their blood work done, they will give them a prescription level so that they have proper nutrition for themselves and the baby. So weight gain during pregnancy. Birth weight is related to a baby's ability to survive outside of the womb. Now, birth weight is related to their susceptibility of certain risks as well. Now, women on average gain 25 to 35 pounds during pregnancy. However, it does depend on where the mother started before her pregnancy. So typically, if the mother is a little bit on the heavier side, less weight. And then if the mother is underweight, a little bit more weight so that the baby has the proper home in the womb to be able to survive and develop fully. Now, doctors can help determine and create plans for appropriate weight gain, and women should never diet while pregnant. Now, I know that sounds kind of interesting to say, considering that some women aren't advised not to gain as much weight. It doesn't mean that their calorie intake is cut to where they lose weight, but so that they eat healthier and maybe exercise a little bit so that they are healthy and the baby is healthy as well. And there's also lots of pregnancy exercise out there that can help during this time to relieve back pain and all those good things that come with being pregnant. So, teratology. Now, this is a branch of science that studies the causes, mechanisms, and patterns in abnormal development, which are teratogens. Now, this is anything that can cause abnormal development. And factors with teratogens are things like genetics, the stage of prenatal development when someone is exposed, the amount, and what type of teratogen it is, if it's drugs, alcohol, disease, or environmental factors. So, speaking of drugs, doctors advise what prescription and non-prescription drugs are and are not safe to take when pregnant, which is one of the most difficult things when you're pregnant during flu and cold season, because there's only certain things that you can take that will not harm a baby. Now, taking things that are not prescribed or that are a certain level and can cause some risk factors can cause things like oral health issues, malformations, deafness, low birth weight, irritability in a newborn, and cognitive and motor deficiencies. Now, alcohol consumption is also one thing that women should not consume while they're pregnant because this can lead to learning disabilities and also mental retardation. And things like fetal alcohol syndrome can occur as well, which is a disorder that may include physical abnormalities or cognitive disorders due to a mother drinking alcohol during pregnancy. Caffeine. Caffeine can also be associated with miscarriages and low birth weight. So pregnant mothers need to make sure that they watch how much caffeine is coming into their bodies. And then nicotine in cigarettes. Nicotine decreases the amount of oxygen in the blood. Well, the blood also goes with the baby. So risk of premature birth and low birth weight. It is the strongest predictor of infant death. There's lowered intelligence and heart and limb defects. So there's lots of things that can cause the baby not to be as healthy once the baby is born. So diseases. Some infectious diseases are transmitted by the mother to the baby through in the womb. And the severity of the effects depends on when the disease was contracted. So things like German measles or rubella can cause things like deafness, blindness, heart defects, central nervous central damage, and or other mental deficiencies. And then HIV, syphilis, gonorrhea. These are passed by the infected pregnant woman to the child while the child is in the womb. Also, once the baby is born, coming through the birth canal as well, depending on what type of STD it is. Now, these can cause permanent defects, and early detection and treatment is very vital to the well-being of the baby, also the mother, but also the baby. Now, other diseases can damage the baby during delivery as the baby passes through the birth canal. And these are two types. So one can enter into the nasal and the throat as the baby is being born, and it can cause learning disabilities and related behavior problems later. And then another is a parasite in cats and other animals. And this, some of us may have thought was a myth, but pregnant women should not clean litter boxes because this is where the parasites are. So that actually is a myth that is actually true with pregnant women. So environmental hazards. So dangers caused by the environment. So pregnant women do have to be careful to avoid eating certain types of seafood that are high in mercury. Mercury can cause cerebral palsy, mental retardation, and growth deficiencies. Now, that doesn't mean that they shouldn't eat any seafood. It's just there are certain types of seafood that you cannot eat when you're pregnant, especially raw seafood. Also, exposure to lead can cause miscarriage, growth deficiencies, and other abnormalities. So living in an old house that has lead paint and things like that. Also with PCBS, which can also be found in water and some fish. This can lead to growth deficiencies, skin discolorations, and cognitive deficiencies as well. So making sure that the water that we're drinking and what we're eating is very healthy when women are pregnant. And then x-rays and radiation. These can lead to leukemia, mental retardation, and growth deficiencies. So a lot of times if you have to get an x-ray, they'll put a protective shield, but they always try to make that a last case scenario. Now, there are also many other factors that can affect a growing baby. So pregnant women should stay healthy, avoid toxin, and receive prenatal care, which is vital to the well-being of the baby and the mother. So we're going to pause again and process what we have just talked about in regard to teratogons. So go back and refer to the slides as needed to answer these two questions. So complications in pregnancy. So some complications in pregnancy can be where the baby is situated. So things like ectopic pregnancy. So normal pregnancies, the baby is in the uterus. However, ectopic pregnancies are when the baby burrows and begins fertilization in a section where they shouldn't, such as the cervix or in the fallopian tubes or even in the intestines. And these can have significant side effects for the mother and the baby. So, a lot of times, ectopic pregnancies do result in the death of the baby. However, the mother's fertility and the life of the mother can also be at risk. So, losses of pregnancy and miscarriages. Well, the unwanted ending of a pregnancy, usually within the first 3 months of pregnancy, is known as a miscarriage. And after 3 months, loss of pregnancy would most likely result in a stillbirth. Now, some risk factors for miscarriages are things like weight, age, and your sexual history. So, things like STDs do come into effect, but also smoking, alcohol, and caffeine can also be risk factors. And there are different types of miscarriages as well. There's a complete miscarriage where all the fetal tissue has been expelled from the body in a natural process. An incomplete where the fetal tissue has not been passed out completely, and typically there's some type of intervention in place to help the mother shed the fetal tissue, such as there's a pill, and then there's also a dilation and cervix cleaning known as a DNC. And then there's the inevitable, which the process of expelling the fecal tissue is in progress. So the miscarriage is going to happen. It may just not have happened quite yet, but the body will shed the fetal tissue. And then there's a missed, which is the embryo dies in the womb but is not passed out. Again, intervention is taking place for that, such as a DNC. And then threatened miscarriage, where the symptoms are pregnant but a miscarriage does not occur. So threatened, the bed rest, they'll do a lot of ultrasounds to make sure that the baby and the mother are okay so that they can prevent the miscarriage from happening. So toxemia and preeclampsia. So these both are an acute hypertension disease of pregnancy characterized by high blood pressure, retention of body fluids, and the presence of protein in the urine. Now, risk factors for this are quite serious, so things like seizure, stroke, organ damage, and death. Now, risk factors for the baby could be also death, but premature birth. Sometimes women with preeclampsia have to have a cesarean section. So they have to have a C-section to help the baby if the baby is not ready to be born at that time, but the risk factors are higher for the mother. So some signs of preeclampsia are things like stomach pain, being very nauseous and throwing up. Swelling is one of the biggest signs of preeclampsia. Headaches, seeing spots, and gaining more than 5 pounds in 1 week due to the swelling and the fluid buildup in the body. So again, we're going to pause and we're going to process what we just covered in the last few slides. So go back and review if needed to answer this question. So prenatal care. So prenatal care includes the detection and treatment of medical problems during pregnancy for both mom and the baby. And during this time, it's really concerned with the detection and treatment of illnesses in the fetus before born. So they're looking for any risk factors that may occur during the prenatal process. They also provide things like counseling, education, childbirth and parenting preparation, and identification for any type of community resources that the parents may need or parent may need. So during a prenatal care session, one thing that does happen a lot is the detection and monitoring of the baby's heartbeat to make sure that the baby is healthy. Regular visits to monitor mom and the baby's health, prenatal tests, and at least one ultrasound to find out if the baby's gender, if the parent or parents decide to do that, to detect if there are multiple babies, to look for growth issues, to check how much amniotic fluid there is, to check the baby's overall health, and to see where the placenta is located. So some prenatal diagnostic methods and fetal medicine things that are used during this time are ultrasounds. And they're used for multiple reasons. So used for gender detection, age detection, placenta placement, and to see if there's any problems with the amniotic fluid or if the baby is not growing or if the baby is too big later when it's time for delivery. Blood work and urine tests are also done to check the ACG levels, also to check for infections and for diabetes. Blood work to make sure the mother is not anemic, to see if there's any STDs, thyroid levels, things like that. And then also to check for gestational diabetes and any birth defects. Amniocentesis, this is where there is a sample of the amniotic fluid withdrawn from the mother's uterus. Now, this is used to detect disorders, to see if there's any interventions that can help the baby. So it's usually performed between weeks 15 and 20. And again, it's used to detect disorders. So depending on the disorder, which could be things like hypothyroidism, where the baby may not be growing how the baby should for the amount of weeks the baby is, medication can be provided to correct this issue. Now, if the disorder cannot be cured or treated, the parents can become educated so when the baby is born, they know what interventions and how to go about doing the best care for the baby. Now, there are two negatives to this procedure. Well, one, it can have false positive results because it's coming from the fluid and not from the baby's genetic makeup. Also, increase of miscarriage. And it's recommended for parents that have a specific genetic profile and also women of an older age. Chorionic villus sampling, CVS, is a procedure by which chorionic villi, the hair on the baby, is removed and analyzed to see if there is any genetic disease present. And it's used for early detection, usually performed between weeks 10 and 12. And it has a lot of the same risk factors as the other procedures, so miscarriage. And it's recommended for the same population, so parents that have a specific genetic profile and women of an older age. So fetal medicine and fetal surgery. Depending on the baby's well-being, doctors may want to intervene medically. So fetal medicine is any intervention or care directed at the fetus in utero. So things like a balloon to help the baby breathe, or spina bifida surgery to repair the spine, or any type of medicine that they may give the baby in utero to help the baby survive outside of the womb. Now, fetal surgery, this is a surgery that is conducted while the child is still developing prenatally. And it can be successful in correcting or lessening the effects of things like heart defects, spinal cord abnormalities, vascular lung issues, or organ problems. But of course, when intervening with a child while they're still developing in utero, there are potential risks. So there could be side effects of the pain medication, infections, blood clots, early labor, premature birth, and death can also occur. So again, we're going to now pause and process what we have just covered so far. So go back and review as needed to address these two questions. So reactions to pregnancy. So pregnancy can be stressful. However, there are 9 months to prepare. There are also options when it comes to pregnancy depending on a person's views of pregnancy and life. And parents typically have 3 options when it comes to their reactions to pregnancy. So parenting is when the parent or parents decide that giving birth and raising the child is the best option. Abortion, taking medication or having a medical procedure that ends the pregnancy, or adoption, giving birth and placing your child with another person or family permanently. So positive reactions to pregnancy can be things like validating sexuality, happy to become parents, or a fulfillment of marriage vows. However, pregnancy can also have some negative reactions, especially if the pregnancy is unplanned or not sure about becoming a parent, or if there's marital difficulties or a lack of social support. Now, regardless of the positive or negative reactions, there are lots of supports out there for women that are pregnant, especially questioning parents or new parents or young parents. So it's best to be educated about all the options before making a decision. And a lot of these that I have here are links to sites that are South Carolina focused. So things like LaVie, Planned Parenthood, Pro Life. There's lots of help out there. So making sure that you understand what it means in regard to the options of parenting, abortion, or adoption before you make a decision is very important if that is your reaction to pregnancy. So now what we're going to do is we're going to pause and process what we have covered so far in the last couple of slides. So go back and review as needed to answer this question. And that is the end of part 2 for chapter 2.